This week's wildfire smoke and poor air quality has had an effect on even the healthiest of us. If you're already dealing with things like a nasty cough, maybe a runny nose, there are some ways you can soothe your symptoms. Destiny Richards tells us what you can do to stay safe and start feeling a little better.
I don't know about you, but this has been me pretty much every day this week. We've been seeing it, smelling it, and breathing it all week. And while the smoke seems to be making its way out of the area, the effects on our health might still linger until it's gone completely. I spoke with a local health expert at Providence to find out why the smoke is affecting us this way.
You're not just breathing the different gases normally associated in air, you're inhaling all those both fine and large particles.
And here are just some of the symptoms you may be experiencing: coughing, congestion, runny nose, stinging eyes, scratchy throat, irritated sinuses, and more. And for those with asthma or COPD, wheezing, shortness of breath, and even asthma attacks are possible. Dr. Getz says if you have respiratory issues, you should see a doctor if your symptoms are getting serious.
I'm always very cautious as a physician trained in emergency medicine. If anybody's experiencing chest pain, I don't just want to say that's related to the smoke in the air. I'd really like you to be seen by a physician and make sure it's not a sign of something more worrisome.
We've been saying it all week. Stay inside as much as possible. Filter your air if you can. And if you have to go outside, wear an N95 mask. But when you're inside, you still have to live with those nagging symptoms. So what do you do about it?
Over-the-counter antihistamines and decongestants actually work pretty well, assuming you don't have any contraindications to taking those medications. They're pretty darn safe and they're inexpensive. That might be something to try.
In addition to those over-the-counter medications, you can soothe your symptoms with cough drops or some tea with lemon. Dr. Getz says those experiencing any smoke symptoms should feel better within the week and as smoke starts to clear. As long as we're in any range that indicates unhealthy air, you're going to want to take it easy.
Still not time to go for that walk on the Centennial Trail. Probably want to get back to that moderate. And even if it's moderate, you don't want to be out for significant periods of time. We want to get back to that good level, which is that safe level.
In the meantime, stay inside, drink lots of water, and your symptoms should clear up as the smoke clears out.
Just make sure you take care of yourself. That hour that you might spend out walking, you might regret a couple hours later. So we should hopefully be through this in the next week. We're seeing progressive improvements in our air quality. And once that air index is safe to go out and enjoy the outdoors.
Destiny Richards, 4 News Now.